Hello, everybody, and welcome to the State of Tennessee DIDD Enabling Technology Talk. With each of our Enabling Technology Talks, it consists of having a discussion or a brief interview with one of our technology partners so that you, the viewer, can kind of understand the different types of technology that's out there to help people that you support to be more independent, to live healthy and safer lives. Today, I'm the host, Milton Neuenschwander, and I'm the tech champion for the State of Tennessee Enabling Technology Program. And today, I will be talking with Rini Gahir, from the co-founder and Chief Business Development Officer of the Mozzaz Corporation. Welcome, Rini.
Thanks, Milton. It's a pleasure.
Thank you, thank you. And thank you for coming and talking to us and having this discussion about the Mozzaz Corporation and your health care platform that you guys do. So before we get into Mozzaz, can you just briefly kind of describe what you do at Mozzaz, your role, and how long you've been working in this type of field?
Yeah, no, for sure. This is great. We've started Mozzaz. I'm one of the co-founders, and we started Mozzaz about 6 years ago. And we have now grown to almost 40 employees, which has been amazing. And we specifically focus on software technology, digital assistive technology for individuals with complex care needs, right? So people with disabilities, the elderly, people with long-term care needs. And this really started from a personal mission. I have a son with autism. My co-founding business partner, Sammy, has a daughter with a complex care need that's long-term in nature. And so, both of us being technology entrepreneurs and around the tech space for almost 20 years, we identified a new way of delivering patient engagement, patient empowerment, care team collaboration, specifically around the world of disabilities and long-term care. So it's been an amazing journey, and it's really becoming it's heartwarming to see that the impact that we're helping to make in communities and societies across the world.
Thank you, and we're glad that we can partner with you and become part of that journey, and we're looking forward to what the journey brings to both of us. So what we are going to be doing today for this technology talk is kind of having just a brief discussion, and Rini has put together a nice PowerPoint presentation that he's going to take us through it. We have some videos that we're going to show you about Mozzaz, and also show you some demonstration of what it would look like from like a viewer using it, or a provider agency that may utilize this type of mobile technology. Okay, Rini, so go ahead and just kind of start us off. If you can just give us like a quick, 2-minute elevator speech about what Mozzaz is all about.
Yeah, no, absolutely. And if you just want to flip to the next slide. So again, Mozzaz is a software technology company. We specialize in delivering an assistive technology patient engagement platform that is really focused on individuals with disabilities and complex care needs. We are not a clinical team. We don't have therapists or nurses or coaches on staff. We are purely a technology company. And we partner with provider organizations, direct service provider organizations like therapists and doctor offices, as well as health plans, and tech enable those practices, bring digital to the world of care plans and helping those individuals with their everyday needs. So we've been fortunate enough to now have over 30,000 members across across the country using the Mozzaz system. And we are a state-approved digital assistive technology provider, so we have a Medicaid provider number in the state of Tennessee, and we are contracting with Choices, ECF, and state waiver programs across the state. And so, one of the areas that we focus on is helping individuals be independent, helping them in improving their individual quality of life through tools that are now accessible, tools that are now socially acceptable, for individuals. So these could be tools to help them with speech and communication. It could be tools to help them with finding jobs and finding, with educational resources, tools to help them with medication management or just meal management. And so the content can really be personalized to the individual's plan of care, and we help build that and configure that with the providers who are providing the direct service. So what we're seeing is, definitely an increase in independence, definitely a decrease in high expensive utilizations of care, and just bringing virtual care to reality. One of the things that we have in the platform is what we call a content agnostic approach. So we built a platform, we built a technology that can be modeled and like a Lego set for any type of care program. And so we've got a sampling of different programs that we're active in across the country. So everything from mental health, could be schizophrenia, to depression, to long-term disability type of projects, everything from physical disabilities to developmental disabilities. We're running a large opioid project out in California as well, and then a foster care program in Memphis as an example. So it's just an example of how the Mozzaz platform can be customized to different programs and services. And this becomes really important because an individual, even in an LTSS type of program, they may have comorbidities, they may have a chronic illness, they may have diabetes or a heart condition, and so their care plans are unique to them, and we can provide them with various tools to help them in those different challenges and illnesses they have.
Thank you. And I think the next slide, we're going to kind of see a video about AIM. And AIM, can you explain what AIM means for Mozzaz?
Yeah, so AIM is our technology that we've developed, and it stands for the Adaptive Intervention Modeler Technology. And this is the heart of the system. So every app, every system, every solution has content. And so what we're doing is we're enabling providers to build content themselves out of content libraries, and snap together all these different digital experiences that keep their clients connected and engaged and using tools that will help them. So AIM stands for Adaptive Intervention Modeler Technology, and here's a glimpse of what that looks like.
Okay.
Cost of care for complex care patients continue to escalate out of proportion. Digital transformation is enabling change with new models of care. Mozzaz Corporation has developed a digital health solution that specifically addresses the challenges in complex care through advanced patient engagement. Its unique AIM technology allows support for complex programs, including long-term services and support, intellectual development disability, mental health, addictions, and chronic diseases. Through data collection and virtual monitoring, Mozzaz keeps patients connected to their care teams and continuously tracks their progress. AIM works. Mozzaz is built on Microsoft's trusted and secure Azure cloud platform with advanced AI for healthcare and support for all mobile devices. It's time for a digital transformation. It's time for Mozzaz.
Great. So you kind of hinted on this before, but one of our biggest things in the state of Tennessee, DIDD, is this idea of person-centered planning, person-centered thinking. And, one of the great things about Mozzaz is that, like you mentioned, is that it can be used to support a variety of different people with different levels of needs, a range of age groups, a mix of disabilities, including mental health issues, physical disabilities, and intellectual disabilities. So these next couple of slides, could you just kind of elaborate a little bit more on that, how it's been developed to be able to do that?
Yeah, everything centers around the individual member or the patient. So as we mentioned, everyone's unique. And so especially in the world of disabilities, so some individuals have different levels of motor capability, right? And some individuals may not be able to move their arms and fingers and have supportive assistive devices such as switches and eye gaze technology that can help them in everyday life. So what we've done is we focus on those personalizations, and we're able to create those personalization or those personal experiences through digital technology rather quickly and efficiently. All this can be designed very quickly for the individual and their individual experience, yet stay connected, keeping them connected to their care teams, right? So care teams can still track data. They can monitor how the individual's doing. They can do a virtual telehealth session, a secure telehealth session with the individual as well. So we're looking at ways where we can provide virtual care support for those members based on that individual's personalized care plan, and making that digital and making it very engaging for that individual.
Nice. And then another big thing is that you mentioned is that you can provide this type of mobile healthcare platform to a number of different members and supports and providers, providing not only choices but ECF, and then now we have partnered with you guys to be able to do it with the state of Tennessee waiver participants through our enabling technology program.
Yeah, absolutely. So we are now an assistive technology registered provider with Homecare, and so assistive technology benefits, and members with assistive technology benefits can take advantage of the Mozzaz solution and the Mozzaz service. So that is covered under a member's AT benefits. And so be it under choices or an ECF program or through the waiver programs, members and citizens can definitely take advantage of the tools that we have. We will work with that member. We can work with the care coordinators and the provider agencies to tech enable the service. And so, we're pretty excited about that, and we're starting to see a lot of excitement around this, bring this type of technology to a wide number of people across the state.
Yeah, and what we've been noticing is that a lot of provider agencies have a lot of what we call blended homes, where living in the same home, they have people that are in choices or ECF along with our state waiver individuals. And so it's great news that you guys can provide this type of service to both, to actually all three of these types of members within these services. So it's great. It's great to hear.
Yeah, no, it is. It's really good, right? So we don't want technology to be a barrier, and we want everyone to be able to have access to accessible technology.
Good. And so now, you talked about mobile solutions, and that could be a number of different things with mobile solutions. And with this being a mobile healthcare platform, I was wondering if you can just kind of describe how you guys use mobile technology, the types of mobile technology that you may be utilizing within your program, and how it helps to kind of further streamline this care services with the provider agency.
Yeah, so part of our AIM platform is a versatility behind the platform. So again, content can be modeled for any digital experience. So that experience could be a staff, right, from an agency who's out in the field taking assessments or note-taking or behavior tracking, even electronic visit verification. We can support that through our platform. So tools to help staff, and then tools that help the individual member and the members' families, right? The caregivers for that individual. So, for the member, the client for themselves, their individual care plan, but the families and the caregivers, the natural supports that help that individual. Maybe it's just some tips and tricks to help with that individual. Maybe it's some medication schedules and meal journals that are added support that provide the additional sort of information that the caregivers can use to help that individual. So we can create a lot of different very interesting digital experiences. And so in the platform itself, we've got everything's based on content, like I mentioned, we have AIM has a content library. So we have a number of ready-made content library sets, if you will, content sets around different diagnoses, around different sort of experiences, all built into the tool. So then members and families and providers can quickly snap together content to build an app, right? And the app could be on a tablet-based format, or it could be a phone-based format. So really, really flexible in the way we can deliver mobile solutions.
Great. And you guys have some goals towards using this assistive technology, so explain those for us.
Yeah, so we're living in the world of IDD and autism. The goal is how can we use technology and I will say smart technology to help individuals become more independent and to participate in everyday in everyday life, right, in the community, in society, in schools, in jobs. And so that all and again, everyone's everyone has a personal care plan, right? So how do we really, really personalize that to the individual's needs and strengths? And so personalization, utilizing technology to help them in everyday life, and making the tools accessible, right? So having it, if someone has motor planning issues, having a large screen with large buttons on it makes sense, right? Having other individuals who are more comfortable with smartphones, they can use their smartphone to manage the content or use the app on their devices. So making it accessible for the right for the individual, and again everything is all around centered on the individual. So the personalization with all sorts of digital tools to help them in everyday life.
Yeah, one of the biggest things that we notice is that, unless somebody is comfortable with using the technology, they're not going to use it. So the easier that you make it, the more accessible that you make the technology to the people that you're supporting, the more likely that they're going to utilize it, and it's going to help them with becoming more independent. And with that is kind of the services that the technology vendor provides to help out with that. And you guys provide a whole bunch of supports to help make sure that this is successful.
Yeah, absolutely. So, I talk about the app or the solution needs to be sticky, right?
Mm-hmm.
If it's not adding any value to the individual, they're not going to use it, right?
Exactly.
So it's got to be personalized. It's got to be engaging. It's got to be, something of value that's helping them in everyday life. Then they will use it. And so, and what we hear when we're talking to providers and to family members is they love the technology. They want to get into it, but they don't know how, or it's too difficult to maintain over a long term, right? So because from a provider's perspective, people change, there's people coming, there's going, there's staff turnover, and so that consistency isn't there from the perspective of supporting a technology. So that's where we come in and we say, well, we will do all the technology heavy lifting, if you will, and ensure that the care plans and the content and the programming, if you will, to support these individuals from a technology perspective is there, right? And so if staff do leave, or if the individual, goes to a different area for support or a different agency, that Mozzaz can follow that individual, and we will be sort of the consistent sort of arm, the support of that individual to help them through their progress and their journey. So, again, we don't want the technology to be a barrier and having people support it. So we're investing a lot in this area, and in fact, we've got staff in the Tennessee area that can provide this level of support as well, directly with providers, and work directly with the clients and the members and their families as well. So we take this really, really seriously. It's not just technology that we hand over. We are part of that process.
Okay, Rini. So this slide, we kind of have like an outline of the cost of these different packages. So can you kind of just briefly take us through how you package this mobile technology, assistive technology together so that it can be versatile to the needs of the individual?
Yeah, we try to create these packages really centered on, what does the individual need? And because this may be new to a lot of people, they're not sure what they're getting, or they're not sure what level of technology support is going to help them. So we try to create, very simple packages like an entry-level package with some really good tools to help an individual with speech and language, with communication, with their personalized content for activities of daily living, right? And we're pricing that around $30 per member per month. And these prices, you know, these are negotiable. These are not set prices, but this is kind of the fee structure that we have today. So technology package A is sort of like the entry level to get an individual with their personalized tools. Technology package B is now extending that and adding some additional tools that will connect them to their therapists, some other of their provider agencies. We will incorporate video and instant messaging and audio calling right through the app, right? And some additional tools such as you know, transportation support tools like public transport schedules, community support content, and even integration to voice assistants, right? So we're seeing a lot of Amazon Alexa and Google Home devices in homes with for individuals with disabilities, and it just opens up a whole new experience with these really cool tools. And so we've got an integration to those platforms and those technologies, and we can incorporate that into the service as well. And then technology package C is basically extending that and adding a lot of content around budget and money management and job support. So this is really tailored to those individuals in ECF type programs. So there's job coaches involved, and the job coach plans are integrated into the tool, and attendance trackers and check-ins and check-outs is all incorporated into that sort of content set. So depending on where you are, depending on your level of ability and the skills and the support you need, we try to tailor the packages to line up with the individual.
Nice. And I have to ask this because we get this a lot from a lot of provider agencies. Does this include the data rates for like phones or your tablets or, you know, the Wi-Fi or internet services within these packages?
Yeah, no, this does not. This is just strictly the Mozzaz software application and the set of services that we provide, all the support and the devices. And you know, there's so many different devices and different data plans, right? So
Yep.
So that's a separate contract.
Yeah, and a lot of times we just tell provider agencies that we would work with them to make sure that they get the right data plan and see if that's something that's supported through their, their assistive technology funding, wherever it may came from the enabling technology program or from Homecare or wherever. So again, we'll just continue to work with them. So good. So thank you for taking us through that. This next screen is just a quick screen kind of showing all your different digital solutions. I don't think we're going to spend much time on it, but our viewers can set on this screen if they want, pause it on this screen and just kind of see everything that you guys do to help out with disabilities. So.
Yep. The point of the screen is, doesn't matter the disability, that we've got tools that help in all sorts of areas.
Exactly. And this next screen, it kind of just shows a good idea of how everything is interconnected. And one of our biggest challenges with our provider agencies is being able to organize that communication, that support, and coordination of the care for the people that they support. Because they, throughout the community, because they may be in the community, they may be at their job, they may be at a doctor's office, wherever they may be, it's always, a challenge to try to coordinate that care. And so if you can just kind of tell us how Mozzaz can streamline this communication and connection with all their care support professionals.
Yeah, you're absolutely right. So like in my world, right? So we have a speech therapist, we have behavior therapists, we've got special ed teachers, right? We've got doctors, and so there's a lot of people in that circle of support. And so what we're able to do is share documentation, share care plans, share notes and data progress and alerts across the different care team members, right? So everything's centered around the individual, and then the different support teams become care team members of that individual. Mm-hmm. And as a care team member, they're able to look at notes and share data, share documents back and forth, right? So a speech therapist may want to share data with a physiotherapist, who may want to share data with an autism ABA therapist, right? So we're promoting and helping with that collaboration. And it seems to be working really, really well, right? So, you know, it's just document sharing and just messaging itself is highly valuable. And then, of course, having the family members be part of that circle of support, so they can see this documentation, they can see data progress, and be part of that communication is really important.
Great, great. Yeah, it's always important to include those family members and their guardians to show that their perspective, their insight, their input is also very important to the care of that individual. Next slide. So this is where we're kind of getting into our describing the different tools that are all the part about Mozzaz and its AIM kind of solutions. So I'm going to go ahead and start this little caption, and why I do that, if you want to just kind of explain us through it.
Yeah, absolutely. So what we're looking at here is this is just a you know, the iPad app showing on the screen here. And so again, you know, what you're seeing is all the different, what we call tiles, or those buttons are different tools. So one tool can open up the individual's care plan, right on the device. Other tools for health and wellness, and they can, you know, with their care worker or a family member, you know, they can add in their information around their health and wellness goal, and the information is tracked and saved and accessible to the team, and you can monitor against it. You know, you can connect to medical devices, Bluetooth devices, all sorts of ways to collect and measure information and monitor information.
Support
quick,
coordinator.
Easy access to an individual's care team, right? So instead of having to go through a phone book, right in the app, I've got an easy visual of who I may want to contact, tap that tile, send a message, right? I don't have to worry about an email piece of software or messaging software.
Gotcha. Good. And the next tool is for speech and language support. I believe this is a kind of a communication type of system. So before I play this video, if you can kind of take us through this so that you don't get interrupted, just kind of tell us what we're going to be seeing here in the next couple of seconds.
Yeah, so we have voice output support in the technology. So we have, you know, I think there's over 50 different voices, male, female, different accents, different languages we can support for voice output. Right, so this is helping people who are perhaps nonverbal or who have a speech difficulty speak, right, giving an individual a voice. Individuals are also able to record their own voice. So we're seeing a lot of voice banking happening. So voice banking is very, you know, relevant in with individuals with ALS, as an example, right? They start to lose their voice over time. So care teams are actually recording the individual's voices and adding it to a tile, right? So they're able to preserve their voice. So, you know, very, you know, speech therapists and a number of different, you know, different professionals, you know, can customize the vocabulary, can customize the wording, the sequence of the words, you know, on a grid or on a tablet, right, and create a voice experience.
Great.
So yeah, you can just run this and we can see an example.
Yep, let's see some examples here.
I want to go for a walk. Watch TV. Computer. I would like pizza. Orange juice. I feel sick. Pain. Back. Left. Hi, how are you? I'm fine, thanks. What are you doing today? Help. I am tired. I need a break.
Okay.
Right. I think that's it. Yep. So that was interesting, where, you know, vocabulary and language can be tailored to the individual, right? Yep. And then the important thing is there's data collection happening behind those that experience, right? So speech therapists or family members can view, what words are being used, what phrases are being used, how can we better optimize that experience for the individual.
Nice. So again, more customizable, more person-centered, so that they can make it easier and more comfortable for the person to use. That's great that you're always looking into that. This next tool is for home care supports and services, ADLs. And so I'm going to go ahead and start playing this, and if you can just kind of talk us through it again and explain what's going on with this tool.
Yeah, absolutely. So visual schedules is really helpful for individuals, that we work with. So there's a built-in calendar in the app with a notification, a reminder that will pop up, right, based on their morning routine or their daily routine. And again, the app can speak, right? So it can talk to you. So it can walk through a number of steps, and so in the olden days, or other without technology, there's pictures on a board or on a wall that walk through a visual schedule. What we're able to do is make this digital, right? So we can incorporate videos.
Or plastic. Would you like paper or plastic?
I would like a little both, please.
Right, so incorporating videos into the experience, right, to help with sort of their task. Video modeling is we call that sort of experience. And so, lots of ways to set this up to help the individual, but also the caregivers who are supporting the individual with just their daily schedule.
Mm-hmm. Good. And kind of that incorporation of videos, it kind of leads us to our next kind of tool as we watch this one go with the vocational supports that we might be able to provide as well. So we can go ahead and move on to that.
Yep.
And it can also provide different vocational supports for people looking for jobs, or that already have jobs and want to maintain their jobs, or are looking to advance in their jobs or their career that they're already doing. So you can go ahead and play this one as well.
Yeah, absolutely. So everything to do with that individual's profile, right? That individual's learning about the job or exploring a different employment opportunity. When they go and visit a potential job, they can rate it, right? And do they like it? Is it something that's going to work for them? Are they able to do it? So just again, getting the individual more involved in their decision making as part of searching for a job is also very important. Transportation support, right? So right within the app, we can build, that individual's personalized sort of transportation needs right into the app, so it's easily accessible. And then again, daily job tasks and steps that the individual can do to be supported. So a number of different tools. We even have individuals when they're at a work site, their cafe menu, they want it in the app, right? So their restaurant that they go to is right there, right? And so now they have an easy way to order an item. And then of course, money management, budgeting, helping them be independent, helping them with, learning these skills. Really, really effective. So, making these experiences, making it easy to use, accessible, empowering, right? Really helping the individual be empowered. And then helping, the job coaches and the employers with tracking how the individual's progressing, right? Everything from digital signatures as well, right? To help with confirmations. So lots of ways that this can be supported. And we're seeing, really, really good use of this in the ECF programs. Very excited and seeing how members and family members are really using this to help them in everyday life.
Yeah, getting jobs for people with disabilities is a big part of our state of Tennessee DIDD's mission as well. We are considering ourselves a employment first type of state, in which we are always looking for ways that people that we provide services to can become part of their community by having that job, earning a wage, a fair competitive wage, and enjoying doing something that they like to do out in the community. So this could be a big part of what we do as well with the state waiver, as well as ECF and anybody who have support. So
Yeah, exciting. Good.
Very, very important.
Stuff.
Yep. And then last but not least, independent living supports. This is another one of our biggest, focuses here in the state of Tennessee, is seeing how people can kind of live independently, and give them more control over their daily lifestyle. So go ahead and take us through this and show us the different ways that Mozzaz can support them in doing that.
Yeah, absolutely. So, the tools that help them with their, everyday living needs, right? So easy contact with their care workers or their support specialists, right? Again, easy way to message them, easy way to get a video call. So, we've got members and their family members who may be living, in another city or another state, are able to call in easily and just see how the member is doing, right? How the client's doing. So easy ways of connecting with individuals, easy ways of connecting with care teams, right? So the whole sort of virtual care model. So, a number of different tools to help with messaging and just staying connected with the care teams becomes really, really important. The other sort of aspect of the system is integrating with remote monitoring type tools. And so, helping understanding, how is my my sibling or my client, doing at home? Did they, are they following their medication schedule? Did they leave their fridge open? Did they close their fridge? All the different home monitoring type of capabilities, and we can do that through Alexa or Google Home type of devices, right?
Yep.
And support. So these technologies do a great job in sort of monitoring all these different
my alarm for 6 a.m.
Alarm set for 6 a.m. tomorrow.
There you go. So it opens up a whole new experience, right? And we're able to do that sort of Alexa, Google Home type of integration.
Yeah, and we have been incorporating Alexa and Google Home into a lot of our enabling technology platforms, and it's really cool to see how quickly the people that we support catch on to using that type of stuff, and how easy sometimes it is to use it if it's designed in the right way and put together where it's something they want to use. So it's good that you guys incorporate that into your technology, because that's a big up and coming thing that a lot of people are using.
Yeah, what we find is individuals with disabilities, even without disabilities, right? It's hard for them to remember phrases, and hard for them to get a consistent sort of, the context of a message, right? It's spoken to a device. And so, having a page with common phrases, right, that are important to the individual, we can program that into the content. And so they just have to tap a tile. So individuals who are nonverbal, just have to tap a tile as an example, and an action can happen, right?
Yeah.
And so really interesting experiences.
Thank you. That's wonderful. So this next kind of section that we're going to be talking about is the care team portal, and how you guys collaborate. You bring all this information together so that everybody can kind of see it all in one place, and be able to then understand how to coordinate their services and supports to be able to the best of their abilities.
Yeah, absolutely. So again, a member has care team members associated with themselves, right? And so anyone who's on the care team would be able to log in and then see information about that member. So it could be about their notes, or it could be something like scheduling an activity or a reminder for that individual. It could be communicating amongst the different professionals in that care team. So the portal is pretty versatile in the sense of just getting everyone connected and sharing information.
And so with all these people being able to go in there, how does your programs work to be HIPAA confidential, make sure that only certain people get the information that they need, and things like that, and being safe and secure?
Yeah, great question. And that's a big, that's a big concern. So we have in our platform role management and policies enabled in the system. So we can assign, the individual belongs to a certain group or a certain role, and there's certain access controls that that group has and that the group doesn't have, right? So we can give them access to certain information and disable access to other parts of the information in the portal. So we can really control that access. And then we also have a lot of auditing in the system, so audit reports. So you can go and see, who's accessed the system, and did they change anything? What was viewed. So there's a lot of controls that we can build into the system to keep everything secure and private.
Nice. You can kind of see some of those reports here.
Yeah, absolutely. So dashboards, visualization, all the data that's being collected can be visualized, and we can restrict who sees those reports, right? And so, again, just creating that extra level of privacy.
And that's, like you said, that's so important in today's technology world, with safety and security in mind, using these different devices, just making sure that it's just like, paper copies, they're safe and secure, and also abiding by that HIPAA compliance. Okay, Rini, so this slide, it kind of summarizes like all the results and outcomes. If you can just kind of tell us a little bit about what we're seeing here on this slide to kind of wrap it all up.
Yeah, this is just a good sort of view of how this data can be aggregated, consolidated, and provide administrators and care team members visibility into how the system's working. Engagement levels. How are people using the app? How frequently are they accessing the system? What content are they using the most? Right. Maybe there's some check-ins and some care plan adherence metrics and measures that they're measuring, right? That can all be tracked and made visual into the dashboard. And we also have alerts, right? So we can have data-driven alerts. So if something's crossed a threshold, alert the care team members, right? If a blood pressure value is high, or someone's hasn't been responding to a meal or some exercise activity, daily living exercise, a care team member could be alerted from the data model. So a lot of measurements that could be visualized and tracked.
That's great. Please explain your MP3 program. It's a really neat name.
Yeah. Yeah. So the MP3 program is really our provider partner program, and we're really excited about this, right? So again, we are the technology enablers that help the direct service provider in delivering service. And again, a lot of providers are excited about technology, but they just don't have the staff or the ability to implement the technology. We tell the provider, don't worry about it. It doesn't cost you anything because it's covered under the members' assistive technology benefit, right? So we can wrap you into the care team, and we will make you part of that digital care team for that individual. And so if an individual is providing speech therapy services or home care services, that content, the care plan, the plan of care for that agency can be incorporated into that member's content, right, into the member's app. Mm-hmm. And so they're part of that now digital care team, and we're pretty excited about this. We got a lot of providers who signed up for this, and fairly excited.
I just want to thank you guys for watching our enabling technology talk. If for any reason, like you're a provider, you're a viewer, a family member, and you guys are interested in Mozzaz's mobile healthcare platform, their tools, their mobile tools and solutions that they're providing, and want to become part of this, MP3 program or one of their other solutions, please feel free to call Rini at the information that we're showing right now on the screen. Thank you so much, Rini, for coming and talking to us. If you would like more information about Mozzaz or any other technology vendor that we partner with, feel free to go to our State of Tennessee DIDD website. We are always have information on there that we can provide to you with other technology talks, some information about technologies, videos that are out there to show you how this technology may work with individuals, as well as just some other educational resources that you may find interesting. just once again, you know, the views of Rini and what he expressed with Mozzaz is basically for your educational purpose, so that you guys can understand what's out there and how this could help support you or individuals that you know with disabilities, that they are looking to become more independent and live healthy and safe lifestyles as an independent person. So thank you once again for watching. My name is Milton Neuenschwander, Tech Champion for the state of Tennessee DIDD Enabling Technology Program, and I just want to say I'll see you next time. Thanks and have a great day. Thank you, Rini.
Thank you, Milton. Thank you, everyone.